Hi, I'm Stacy Taylor, and I'm presenting my video on coordinated care of PN, slides 9 through 14. So I'm going to get started, okay? So we're going to continue on with Unit 2, and we'll briefly discuss case management. Does anyone recall what case management is or what it involves, or even why we have case management for the client? Good. Jessica says the case management is a way to give good quality care to the client and provide cost effectiveness or save money. Okay. Anybody else? Brandon? Great. Brandon said it's being a client advocate. Okay. And one last person. Alicia. Continuity of care. Excellent. All of those are great answers. Okay. So basically, case management involves working with other agencies or other departments or even out in the community and making sure the client has community resources so that they'll have a quality of care and cost effectiveness or saving money. So when you have that diabetic who needs a blood glucose monitor because theirs is broken or they don't have one, we're going to put things in place or collaborate with others to make sure that they can get what they need, okay? So the PN is going to collect the data, do the assessment, see what the client needs, and the PN and RN will collaborate together, okay? The RN will actually coordinate the referrals. They may make a referral to that social worker so that the blood glucose monitor could get ordered or be provided to that client. Okay, not going to spend a whole lot of time on here. So I just remember quality of care, continuity of care, and a cost-effective approach. Okay, let's move on to a question. Okay, so an emergency department is notified to expect multiple victims from an apartment fire. Of the following clients, which one should the PN delegate to an AP? A client with option 1, partial thickness burns of the hands who require assistance to remove clothing. Option 2, soot present around the mouth who requires assistance with ambulation. Option 3, ankle pain who requires wheelchair transport to an x-ray department. Or option 4, uncontrolled shivering and requires a change of clothing. Okay, so get your cards ready. I want you to read over those options. Use the stop truck strategy to help you select your the best choice. Okay, looking good. Look like most of you selected option 3, which is the correct answer. Okay. So let's just take a look at all the options. Okay, no one selected option 1 or 2. Okay, so when you're looking at that and using your stop strategy, I mean, you looked at your situation to see what the story or the issue was, and you had a fire, an apartment fire with lots of victims, and we needed to delegate to the AP, make delegation to the AP. Okay. And you're thinking safe and effective care, what were the key words in the STEM? Okay, that an AP does basic skills, okay, and they function under the direction of the PN. So option 1, remove clothing. Of course, the AP can do that, but you look at partial thickness burns, and this client is unable, they require assistance to remove clothing. So that client actually needs to be what? Excellent. It needs to be evaluated or assessed by the PN. Okay, so we don't want to delegate that client, okay, because he's not stable. We don't know if he's stable, okay. What about option 2? That soot present around the mouth, we're thinking that client may actually have an inhalation injury, okay. We don't know, but the client does need to be evaluated, okay, because he's at risk for good respiratory problems, okay. Option 3, the client with the ankle pain has a problem, okay? Seems like he's pretty stable. He has a pain. He's going to x-ray to actually get that checked out. So the PN, that task can be delegated to the PN to transport that client to the X-ray department. And then option 4, the uncontrolled shivering. Do we know if this client is stable? No, because the shivering, I mean, he was in a fire, he could have gotten wet, but also that shivering could mean that he's what? Excellent, hypothermic, okay? So we don't know. So clients 1, 2, and 3, clients options 1, 2, and 4, those clients need to be evaluated by licensed personnel. So we don't know if they're stable or not. So we don't want to delegate those to an AP. Okay. Good job. All right. The next slide question we have is one choice as well. Care of 6 clients is assigned to a practical nurse and an assisted personnel. Which intervention is the correct plan for organizing care? Okay. Option 1, each team member would care for 3 clients. Option 2, the PN would care for 4 clients with the other 2 assigned to the AP. Option 3, assign all clients to the PN and delegate tasks to the AP. Or option 4, prepare a schedule for the PN and AP to rotate care as needed. Okay, so I'll give you a second to make your choice. Don't forget, use your stop strategy. Okay, and it looks like everyone has selected option 3. Very good, very good. Okay, so with this, we know that option 1 and 2, can the AP take care of clients? No, they cannot provide total care to the client. So we can scratch those out. Okay, option 3, of course, all the clients would be under the care of the PN. They would be providing care, and then they would delegate tasks to the AP. And then option 4, prepare a schedule for the PN and AP to rotate care. Again, total care is not an option for the to be delegated to the AP. Okay, so you guys are doing great. All right, next slide. We're going to talk about the 5 rights of delegation. Okay, so you will be expected to apply this information to a situation on NCLEX. Okay, you're going to have to apply it to a situation. So just looking at this slide, we know that, can anyone tell me what 5 rights are missing? Kennedy, right circumstance, good. Somebody said right person and right task, excellent, excellent. Okay, so your situation here is the PN tells the AP the client should ambulate 20 yards every 2 hours, okay? You want to ambulate the client 20 yards every 2 hours. All right. So what's missing as far as supervision is concerned? You want to think, what else? What to report? How they tolerated it? Were they in any pain? Good. Excellent. Okay. And when to report it. Okay. So that's the right supervision and evaluation. Okay, and as far as directions are concerned, is anything missing? Any assistive devices, equipment? Someone said oxygen. Anything else? How much assistance they need? Do they need 1 person, more than 1 person? All of those are good answers. You guys are amazing. Okay, so before we go to the next slide, we'll just do just one little quick activity to delegate or not to delegate. So we'll just do a few, and I'll put the slide up, and I want you to hold up your red card if you do not delegate to an AP, and your green card if you do delegate to an AP. I'm sorry. Okay, so the first one. I'm sorry. Okay. A PN to complete an assessment of a client just transferred from the ED to your unit. Excellent. Red. Okay, we know that a PN cannot complete an initial assessment. Okay. An AP to gather and document output totals of the clients on the unit. Wow, we got all green for that one. Good, good. The AP can document intake and output. Okay. An AP to increase the oxygen flow rate from 2 liters to 4 liters per minute on a client with a chronic respiratory illness. Look like we have some green and red. So for this one, it should be red. We do not want to delegate because oxygen is considered a what? Good, a medication, okay? And so in that case, they would AP would be making changes to medication, so we do not delegate that, okay? All right, and then this is the last one. A PN to provide teaching to a client newly diagnosed with atrial fibrillation. Again, we got a little mix here too, okay? So we went in red, do not delegate, okay? A PN can reinforce teaching, but this is a client newly diagnosed with atrial fib. So they cannot initiate teaching on this client because that would be initial teaching, okay? All right, great job. Let's just move on. All right, just talking about the review of the scope of practice briefly. Okay, so your AP, ADLs, basic skills and tasks. They can perform ADLs, basic hygiene, nutrition, feeding, routine vital signs. Okay, that's going to be the routine vital signs. Weights, intake and output, and of course, maintaining a safe environment. Okay. Your PN, their scope of practice, take care of stable clients, you know, those clients with an expected outcome or predictable outcomes. They do collect data and they reinforce teaching. Okay. Is there anything else that's not up here that we think the PN could do? Good. Monitor IV fluids. Administer IV piggybacks. Good. And monitor the IV flow rates. Good. Those are all good options. Okay. And then the RN cares for your unstable clients. They take care of the assessment, do the teaching, the initial teaching, and the plan of care, initiating and resolving the plan of care. Okay. So can the PN initiate a plan of care? No, but they can contribute to it. Excellent. They can contribute to the care plan. They can collaborate with the RN, but they cannot initiate or resolve the plan of care. Okay. So there's also a delegation worksheet in your book. I think it's on page 13. So you might want to take some time later this evening to do the worksheet, and also you can check your own answers. Okay. All right. And then prioritization, okay? Prioritization we know is essential for safety, okay? When you're caring for multiple clients, sometimes often we have to actually prioritize our care. See, who are we going to see first, okay? Earlier this morning, you actually wrote your prioritization strategies on your table 10. So we have some questions in your book, some scenarios in your book that we actually want to do, and you can refer to those, okay? So for group A, the clients in group A, a client receiving morphine sulfate via PCA pump with respirations of 8 per minute, a client 2 days post-op following right knee replacement who has not had a bowel movement, a client who has a left below the knee amputation who is having difficulty with body image, and then you have a client who has a heart rate of 110 per minute after an albuterol respiratory treatment. Okay, so look at those. Which client would the nurse need to see first after their morning report? Okay, and think about those principles of prioritization, you know, Maslow's hierarchy, actual potential versus actual, stable versus chronic. Okay, think about those different prioritization strategies and which one will we see first. Let's show by our numbers. Good. Looks like it's a unanimous decision that we'll see client 1 first. Good. And why is that? Yes, we do. We expect the respirations to be decreased when they're on morphine. We do. But we're thinking what? ABCs. Excellent. Okay. So airway and breathing. Unexpected before expected. Actual before potential. Good. So when you look at those other clients, client number 2 is just a potential problem. They hadn't had a bowel movement. So that's a potential. And client 3, difficulty with body image. That's on Maslow's, but it's pretty low. It's self-esteem. All right. So option 1, what's the best choice? And then option 4, that's expected. Okay. Okay, group B. I'll give you a minute to read those. Okay. Good. Option 2. Option 2. And why is that? Excellent. Because it's a physiological issue. Okay. That temp is pretty high for 2 days post-op. Okay. So it's unexpected, and it can also lead to what? Sepsis, which is a systemic issue. Very good. And then lastly, group C. Okay. So let's show our cards. Option 4. Excellent. Excellent. So you expect this client does have an actual problem, and what is happening? An allergic reaction. We're thinking an allergic reaction to the contrast. So that is an actual problem. Unexpected and actual. Okay, you're thinking airway and breathing. Okay, you guys have done amazing with this unit this morning. Okay, exceptionally well. Okay, are there any questions? Okay, so at this time, we're going to take our break. It's 10 minutes to the hour, and then I'll see you back promptly at 10 o'clock. Okay.